Hi, I'm Annie Williams, and I'm here to give you a brief introduction to my class entitled Taking Care of Your Own Neck and Back. The first thing I'd like to teach you is that most of our lower back pain comes from our psoas muscle. Our psoas lies deep in the core of our body, from our pelvis connecting into our spine, and from our thighs connecting into our spine. I find this to be one of the muscles that causes the greatest amount of back pain, and it's very easy to treat this muscle. So what I'm going to do is show you how we can make this muscle relax by positioning. First thing I'm going to show you is how to relax the psoas muscle with positioning. You'll want to have a chair or an ottoman, and you're going to lie down onto the floor and bring your leg up onto the chair, one at a time. Now the next leg's gonna come up and cross your ankles. Once you've achieved this position, you're going to pull your chair up until your hips and knees are flexed beyond 90 degrees. Now, your job is just to lay here for 90 seconds and allow those muscles to relax and release. We're going to assume 90 seconds has gone by because I'm going to teach you how to relax the next muscle that causes significant back pain. When we're coming out of the hip flexor release, we'll want to come out one leg at a time. The next muscle that we're going to be releasing is called your tensor fascia latae and IT band. It is the muscle lying on the side of your hip and your leg. And to relax that muscle, we can use a chair or we can use a couch. All we're gonna do is lie down on our side and place your leg onto the chair, slightly behind you, and trying to keep your knees straight. Now you're going to relax in this position for 90 seconds. I find a great time to do this is when we're watching TV and the commercials come on. I'm reminded that I have at least 90 seconds to relax this part of my body. So relax. When you've completed 90 seconds, you can bring your leg down and simply switch sides. The next muscle I'm going to teach you how to relax and release is your latissimus dorsi. The latissimus dorsi is a large muscle lying in our back and connecting down here to our pelvis. It is a shoulder muscle. Its job is to pull the arm back. So it's used in lifting, and that's how we often injure this muscle and start giving ourselves back pain. It's very easy to release this muscle. All that one has to do is lie on the floor or on your bed and take your arm, rotate it internally, and drop it behind your back. And let it relax here for 90 seconds. There's an alternative way to relax this muscle if it's not easy for you to be on the floor or it's not convenient at the time and you need to relax that muscle because you're in pain. So the alternative position for relaxing this muscle, you can do in a seated position. What you'll do is reach the hand behind you as if you're reaching into your opposite pocket and simply sit on your hand for 90 seconds. If you're able, you can actually release both of your latissimus dorsi at one time by crossing your hands behind your back and sit on your hands. I teach people to do this when we're sitting at stoplights with one hand at the first stoplight and do the next hand at the second stoplight. The stoplights are usually at least 90 seconds So while we're sitting there doing nothing, we can be treating our back. To help our neck pain, I'm going to show you an easy technique for releasing our sternocleidomastoid muscle. Yes, that's a big word, and it's a pretty small muscle, but we use it a lot. It goes from our ear to our sternum, and our ear to our shoulder. To relax this muscle, all we have to do is assume the position of Rodin's thinker statue. You're going to place your eye in your hand and your elbow on your knee, flexing and rotating your head, and let it relax right there for 90 seconds. When you've completed 90 seconds, you'll want to do the other muscle on the other side of your neck. So we're going to repeat. Place your hand on your eye and let your elbow relax on your knee, relaxing your head in a position of rotation and flexion. Great. Now I'm going to show you a little stretch for this muscle and our pectoralis muscle at the same time. To do this, you're going to go to the wall and stretch out your arm. Then, taking a sideways position to the wall, you're going to use this hand to turn away from the wall, and now you're going to drop your head back. Stay in this position and breathe for 6 breaths. Great, now let's repeat this on the other side. Extend your arm on the wall, place your other hand on the wall. Use this hand to rotate away from the wall. Now drop the head back and breathe 6 breaths. Great. Now I'm just going to show you how to stretch the other part of this muscle. You can do this in standing or sitting, whichever you prefer. You're going to place your hand under your leg to depress our shoulder. Now with your opposite hand, you're going to reach over your head and side bend your head, your ear to your shoulder, and breathe. Once you've completed this, I want you to drop your head slightly forward into flexion and let your hand go to the back of your head and let that head hang down. That's a stretch for our levator scapulae muscle. To stretch our latissimus muscle, we're going to show you some doorway stretches. I'm going to show you a doorway stretch that will help you stretch out your latissimus dorsi and your tensor fascia lata and IT band, which I showed you earlier how to relax. To do this, you're going to face the doorway and create a window with your arms. Now you're going to lean away from the window until you feel the stretch all the way down the side and into your hip. And breathe in this position, 6 breaths worth. Great. I'm going to demonstrate for you stretches out our latissimus dorsi. What I'd like you to do is reach up. If you're not able to reach the top of the doorway, you can use arms here. What we're going to do is try to become the front of the ship. So I'm going to ask you to hold your tummy in, spread your legs apart, and place your hands on the doorway as high as you are able. Once you've done this, I'm going to ask you to bring your chest in, and now I want you to take a deep tidal volume breath. And now you're going to take 3 more breaths to stretch your intercostals. Here we go. Breathe in. Now 3 more breaths. And exhale slowly. Breathe in. Take 3 more breaths. And exhale slowly. Trying to let your body come forward through the door as much as you can. Breathe in. 3 more breaths. And exhale slowly. The next exercise I'm going to show you is to stretch out your pectoralis muscles that lie in your chest. To do this, I want you to place your whole forearm on the doorway frame. And you're going to hold your tummy in so that we're not stretching our low back but our chest, and let yourself fall forward like the front of the ship. Now you're going to take 3 deep breaths. And exhale. And 3 deep breaths. And exhale. And 3 more. And exhale. Relax, bring your arms down and rest. I hope you'll come back and learn more about how to take care of your own neck and back with Annie Williams. Thank you.